Hello and welcome back. We've moved on to Chapter 3. We're really going to focus on the key concepts and steps to qualitative and quantitative research and really focusing on what makes them different. We are going to spend the rest of the 8 weeks talking about and delving into each of the steps that are involved in qualitative and quantitative research, starting with quantitative first. But before we do that, we have to develop a key concept and key terminology that we share so that we can speak the same language. And you will find that when researchers are speaking to each other, and even when consumers of research are speaking to each other, that we use the same type of language. And you'll get way more comfortable with this language as you read more studies and become more involved in evidence-based practice and research. So some key terms and key concepts are who provides the researcher with answers to their questions. So in quantitative study, you'll hear them either be called subjects or study participants. In qualitative studies, they're often called informants or study participants. And study participants, when grouped together, are called a sample. And when we describe samples in a research study, we're talking about the descriptors or the findings of that group of study participants. Study conductors may be called researchers, investigators, but one specific researcher is typically the principal investigator, and that principal investigator is responsible for bringing together the research team, providing guidance so that the research study is done congruently and the same start to finish, because that is what is going to ensure a good research study. And there are some concepts that are called abstracts and phenomena, and those are specific to qualitative studies, and we will delve into those more when we start to cover qualitative studies. So a theory or a conceptual model is the systematic explanation of some type of reality, and it really is those theories, and hopefully you've heard of nursing theories or have talked about concepts or conceptual models in other courses, but those really are the theories that knit concepts together into a system, and they play a role in both qualitative and quantitative research. They are often what is described in the very beginning of a study, and it's really kind of where that researcher is coming from in their worldview, and kind of sets up the scaffolding for that research study. So here's our first knowledge nugget. Tell us whether the following statement is true or false. A variable, so a study variable, is a characteristic or quality that takes on different values. And that is true. That's the exact definition of a variable in a study. And we're going to give you some examples of some variables. The next question or knowledge nugget is the dependent variable, is that the presumed cause of the problem? So dependent. And when you think about dependent, this is actually false. So the dependent variable is the variable that is dependent on the independent variable. When we talk about quantitative studies, the independent variable is often the thing that gets changed, or the item that gets changed, to see if it makes a difference in the result or the dependent variable. And this is just the definition yet again, a characteristic or quality that takes on different values, that's something that varies from one person to the next. So examples are blood type, weights, length of stay in the hospital. It may be include things like patient satisfaction or hospital-acquired conditions such as infection control rates or falls rates or pressure injury rates. So that's a variable. And the independent or dependent outcome is the direction of influence or a causal link. And I will tell you that it's usually in a nursing study, it's a direction of influence. When you look at true experimental studies, where you have a control group and you may have a randomized controlled trial, that you can infer causation, but you can never truly prove causation. It is very hard to even insinuate causation in a nursing study. And when we look at nursing studies, it's typically hard to say this thing caused this thing to happen. And that's because we work in a science where humans are involved, and there are many factors or variables that impact each other in outcomes. So, for example, I'll give you the perfect example. Falls, and I keep coming back to this because this is, again, probably the easiest thing for me to speak to. It's my area of research, but it's also an outcome that most individuals, regardless of being in healthcare or not, understand. So the use of bed alarms. For many years, the use of bed alarms influenced if a patient fell or not. So now but there's no way to say that it's that one intervention that prevented it from happening. There are lots of things that can prevent a fall from happening. Patient never gets out of bed. The patient always has calls for help, and somebody's always in there with the patient. So you can't really directly infer a causal relationship in many of the things that is studied in nursing science. So when we talk about variables, there are all different kinds of variables, but when we look at, there's four main types of variables. Continuous is the first, and that's height. And that's because there are many, many different measurements in between. And when you compare that to a discrete variable where you can't have a half of a child, so a number of children is a perfect example, number of siblings, height, you could be 5, 6 and a half, but you can't have a half of a child. Categorical means that you are typically fitting into one category or another. Gender identity can be fluid, but often is categorical, so that individuals are choosing that gender identity from a list. So there's typically a list. And when you think about marital status, it's a perfect example. Someone is single, married, widowed, divorced, meaning that they're going to typically fit or choose one category. Dichotomous is easy. It's either one or the other. It's a dichotomy, so yes or no, male or female. So there's only two choices, and that choice comes from one or the other category, but can't be both. We talked a little bit about independent variable versus dependent variables, and again, remember that the independent variable is the thing that changes, and the dependent variable is the presumed effect of that independent or the thing that changes. For example, smoking and lung cancer. Again, not a direct causal relationship, but definitely influences the development of lung cancer. Another one is obesity and high blood pressure. Again, obesity alone does not cause high blood pressure, but it definitely influences or predisposes someone. Confusion can be the cause of a fall. So that's another one where, if a patient gets delirium during a hospitalization, that can directly impact a fall occurrence. So we're going to talk a little bit about independent and dependent variables in some of the online forums. So there are conceptual definitions and operational definitions, and keep in mind that conceptual is exactly what it sounds like. It's more abstract, it's more theoretical. It's a definition of that concept that's being studied, but it's definitely more abstract. An operational definition is how a researcher defines what they're going to be collecting. That may be age, That may be gender at birth, it may be gender identity. So it's those measurements. It might be a tool, it may be height, it might be weight, and often those operational definitions guide the researchers, so not necessarily the primary investigator, but say there are 3 researchers on a study. That operational definition will definitely help each one of those researchers measure that item exactly the same. And you will find that operational definitions are not always included in research publications, but the most important typically are. So patient satisfaction. Okay, well, how are we going to measure patient satisfaction? Well, we're going to measure patient satisfaction with X, Y, and Z questions from this database so that everybody is using the same data measurement and everybody is doing things exactly the same. We don't want one researcher to do things different than another researcher, or there is not that internal validity. Data is what we're collecting. That's the information. It can be quantitative, it can be qualitative, and we're going to talk in depth about what the difference is. Relationship is just that, a bond between the variables. We talked a lot about cause and effect. Again, way harder to definitively determine a causal relationship. We often in health sciences use the we will say influence instead of cause, because we can never directly tie it back to that one thing, such as cigarette smoking and lung cancer. Not everybody who develops lung cancer has smoked cigarettes or have been around cigarette smoke, so it's not technically a causal relationship. Functional is really what we're looking at, or associative relationship is what we're typically looking at in the health sciences. There are 2 major classes of quantitative research. The first is experimental, and that is where the researcher is going to introduce an intervention or treatment. Some examples of experimental research include drug trials. So the researcher will actually give the participants this drug. A randomized controlled trial, meaning would be an example of that would be you have 2 groups. One group gets the drug, the other group gets the placebo. Nobody knows what they're getting, whether it's the drug or the placebo. And that is actually, randomized controlled trials are actually the highest level of research studies. We don't do, like I said in the previous presentation, we don't do a lot of that in nursing because there aren't many interventions that we randomize. I can see where that sometimes can happen when you look at preventative measures, you know, before and after, or this group on this unit got this treatment for, or this preventative treatment for a pressure injury, and this did what we have always done or what we consider routine or standard care, and was there a difference? But that's truly not experimental research in the fact that or a randomized controlled trial, because it's not, people are not being randomized. Non-experimental research is really just collecting data without doing or intervening on that research group. So looking at items over time, doing longitudinal studies. There are a lot of qualitative data is non-experimental in that we're looking at focus groups and kind of the lived experience. So what is the first phase in a quantitative study from your reading? So the first phase in a quantitative study is the conceptual phase, and this is really where you're doing your review of what you've found in the literature. You're defining your problem. You're defining the framework, formulating your hypothesis. This is your what if or your what is happening phase. And this is really kind of a brainstorming phase, a digging into the literature, seeing what's been done before, looking at, okay, you know, this is something that we might be able to include in our study, doing an evaluation of where the study is potentially going to happen. Is it something that has already been studied? Often if it's been studied in depth in your type of setting, you know, what is going to make your study novel versus that study? Phase 2 is really design and planning, and this is selecting your research design, and we'll get into that kind of definitions of different types of research design when we get in a little bit more in depth into quantitative study. Developing those interventional protocols, who are we going to be studying it on, or who is the population, and designing the plan, the sampling plan. So what are we going to intervene with? How do we define that? What are those operational definitions? What is the plan to intervene on that population? So are we educating? Are we providing some type of intervention or treatment? And then how are we going to get the information back from those individuals? What methods will we be using to measure the variables and collect the data? So a data collection tool is often identified during this stage. We'll talk a little bit about IRB when we talk about ethics of research, but developing methods to protect animal and human rights. So when we look at some research studies that have been unethically done throughout history, we think of studies like the Tuskegee Airmen study, where the researchers actually inflicted syphilis on a group of high-risk individuals and watched to see how that played out, essentially. Some of the other studies that we think of that have been afflicted upon high-risk individuals are those studies that were done during the concentration camps in Germany, and how those individuals that were housed in concentration camps essentially were used as living human rats and were experimented on a pretty regular basis. So we have a long history in the human race of not necessarily having the highest ethical standards related to research. And there are definitely mitigation factors that are in play to protect humans and animals. You want to finalize and review the research plan before you take the next step, which is that empirical phase or the data collection phase. And the data collection phase is exactly that. This is the work of the study. So providing the intervention if it's an interventional study and collecting the data. And then getting that data ready for analysis. And you'll hear words like cleaning the data, and I don't want you to think that anybody is manipulating the data. Cleaning the data is really taking out those maybe data that isn't complete, that can't be used for the study, or erroneous data. But nothing, a good research study should never remove data just because it isn't what the researcher is expecting. And then one of the last phases is that analytic phase, which is the analyzing of the data and interpreting the results. Often during this phase, a researcher will employ a statistician to help with the analyzation of the data and making sense of it. And the very and probably the most important phase is dissemination. A research study does nobody good if it sits on a shelf somewhere and nobody is reading it. or using it to influence practice. A research study is a huge undertaking. And for those who really enjoy doing research, the dissemination phase is the whole crux of the research study. So it is the reason why we do research. It is a lot of work, but the findings can be very eye-opening. One of the research studies that I actually as the primary investigator as part of my DNP studies was looking at the level of nurse experience and its impact on falls. And what we were seeing is we had just started a nurse residency program at the hospital, and what we were looking at was, anecdotally, we thought we were seeing that most of the falls happened with the newest of nurses, so during that first year of practice. But we didn't know that for sure. That was just what we thought. And so we had a what if, let's look at this data. So we did a retrospective, descriptive study looking at, was it truly what we thought? And actually, we were super surprised to find that our hunch was absolutely not true. They were the second highest rate of falls were with the brand new nurses, but actually the highest rate of falls happened between year 5 and 10 of nursing experience. So those nurses that had just enough experience to feel comfortable in practice, and you'd say by 5 years, I hope so. But when we paired this with some of the engagement data, it actually is the time where nurses' engagement falls off. And so it's very interesting to us that those two things correlate. Now, did we ever do a follow-up study to see if that was the reason, that it was engagement or comfort is why that we saw that drop-off in falls kind of surveillance at that point? We never did follow up on that because we got caught up in doing another study. But we thought that was very interesting because sometimes you think you know what the data is showing you, but until you do any type of data analysis, it's pretty surprising. And I will tell you, that was a pretty big study. It was 400 charts, 400 falls that happened over the course of 1 year at our institution. And it was very interesting when you look at a large sample size like that. The other thing is we thought that staffing 100% of the time had a major impact on falls rates. And actually we found that staffing did influence falls, but it really wasn't nurse staffing. It actually was ancillary staffing that had the biggest impact on patients' falls and when they occurred. So it was very eye-opening, and we actually did some work around that and advocated for more ancillary staff, which was a little bit easier to get if you think about it. Employing some extra nursing assistants in the case of falls prevention was an actually easier financial investment than having more nurses. So there's really only 3 phases in a qualitative study. Do not mistake a qualitative study for being easier, because in some ways qualitative studies are much more difficult to produce and set up. But there's really only 3 activities, and that's conceptualizing and planning the study, conducting the study, and disseminating the findings. You're still going through those steps. They're just done a little bit differently. Research journals really focus on, it's really the primary method of disseminating research. It's also looking at the context, the design, the sample, and then the results of a study. These are typically the content that is included in journal articles. The abstract, which an abstract just tells you what the study, kind of gives you a summary of the study, kind of the cliff notes of a study. And then there's usually introduction, which is really a summary of the lit review, methodology, which is really the design of the study, results, which is essentially the hard facts of the study, those statistical findings, and the discussion will often include something called nursing implications or implications for practice, and that's really where those results are further discussed, as well as implications either for future studies, limitations of the studies, implications for practice. If I can recommend that you read a few things, if you have to, I will tell you how I read a nursing study. First, I'll start with an abstract. I read the abstract to see if it's measuring, because the title doesn't always tell you exactly what the research study is measuring, but I read that abstract to tell me what they actually did. It tells you usually the size, the sample size, and it usually will give you some results with some few sentence discussions. I usually will start with the discussion because the discussion is going to tell me what are the implications for practice. That is going to tell me if I feel like this study is going to be applicable to me. The introduction is just a background. It's a really great place to find out what's already in the literature prior to the study happening. The methodology is something you will get used to reading, and that's really what you're going to critically appraise to see if it was set up, if the study was set up well. This is where you'll find your sample size. You'll find out what kind of hospital or setting it was done in. How did they operationalize definitions if it's included. But that is the nitty-gritty of the design, and then the results is really the statistical analysis. Once you become a little bit more advanced in reading nursing studies, this is a great place to start because you'll often find the tool here. What tool did they use? And then when we talk about p-values, they're going to discuss the statistical significance in this section. But it takes time and practice to really develop a good process for reading research studies. Definitely different journals have different types of articles. Most articles have to be a word limit or a page limit. So you won't find everything that was done in the study. There has to be some summary because there is no way that every study is going to fit into a journal article that's short enough for the average person to read. You will find jargon in there, but one of the things that we really look for is objectivity. So was it set up well, and did the researcher provide an objective way of not only looking at the data, but especially in that discussion. And then the statistical information that were included. So how many individuals were included in the study? And every journal has different requirements based on the type of journal. So there are journals that include both quality improvement projects as well as research studies. There are journals that are strictly research studies. There are journals that research is written at a more understandable level versus at a higher level. So a heavy research journal is going to be a heavier read than, say, a research study that's in a practice type journal. And when we talked a little bit about what type of journals you should subscribe to early on in your career, you should look at those journals that may not be as heavy of a read. It takes some time to build those skills, just like anything else.